Bismillahirrahmanirrahim. Assalamu alaikum, dear audience. Today, our topic of discussion is about a very challenging and complicated eye disease which is related to medicine's reactions. I'm talking about Stevens-Johnson syndrome. We will discuss which medicines and how these medicines can cause Stevens-Johnson's syndrome, what are the signs and symptoms, and possible management. When we talk about the medicines which can potentially cause this life-threatening as well as vision-threatening condition, it belongs to the antibacterial group, and the leading cause is the medicines which can cause is the trimethoprim sulfamethoxazole group of antibiotics. That is the leading cause which can potentially cause this disease in some patients. Apart from this, some medicines like used in epilepsy, for example, we call it carbamazepine and phenytoin. Some medicines used in joints, that is allopurinol, so they can also cause Stevens-Johnson's. When I say they are causative factor, it means not in everybody, but a few patients who can develop these conditions. Otherwise, these medicines are quite safe, but these are the medicines which can potentially cause in some patients this vision as well as life-threatening condition. When these patients present to us, usually they have got they are in very serious condition. They have got blisters on their body, have fever, and this is a type 4 hypersensitivity reaction, which is a severe form of bodies reacting against these medicines. And the mucous membranes, the oral cavity, inside lining, that is affected, the internal organs, kidneys, livers, lungs, GI tract, all these things are involved. But when we talk particularly about the eyes, it affects conjunctiva, eyelids, and the corneas. So when we talk from the eye point of view, as I mentioned, this disease affects eyelids, conjunctiva, and the cornea. These patients develop dryness. The glands which were contributing to the tear films, they are no more working over there. So eye becomes dry. Once there is no tear film over there, eye is dry, the patients can develop corneal ulcers over there. Once corneal ulcers develop, he is very much prone to infections over there. Secondly, also, patients develop adhesions in the conjunctiva. Conjunctiva is the white layer covering the eyeball, and it develops adhesions over there. So it becomes even difficult to open the eyes because it undergoes shortening over there. So once the scarring is happening inside under the lid margin, the lid margins are pulled, the eyelashes are pulled inside. So the contour of the lid margins is also affected. So these are the complications which can happen, affecting the eyelids, and then scarring happening over there, dryness, and the corneal ulcers, and ulcers are there, then the route for the infection is open up over there. We talk about the management of these patients presenting with Stevens-Johnson's. They're already usually in acute phase in intensive care. All the medical specialties over there are managing, and from eye point of view, we have to go and regularly monitor the eyelid condition, their location, their contour, dryness, whether it has developed, condition of the conjunctiva, cornea, any ulcer has developed or not, regular cleaning of the eyelids, any pseudomembranes, it should be removed from there properly. So regular follow-up is very critical during the acute phase. Acute phase, when we talk, it goes up to 4 to 6 weeks. These patients can be put on the topical steroid eye drops to control inflammation, to control the formation of the scarring, Antibiotic steroid ointment can be applied on the eyelids. Very important is the hydration of the eyes, and for this round the clock sometimes they need topical eye drops. They're lubricating eye drops which we call, and to prevent secondary back, if they can develop corneal ulcer anytime. So at this stage we have to give him the coverage of the quinolones eye drops. For example, moxifloxacin eye drops, antibiotics are very good, they should be covered over there, should be used in these patients. So all these things are very important, regular monitoring, especially during the acute phase. When we talk about the surgical management of these patients, as I mentioned, these patients develop adhesions between different parts of the conjunctiva, which we call symblepharon or ankyloblepharon. Eye is very difficult to be opened up, it becomes small. We have to take help from our oculoplasty colleagues, the eye plastic surgeons who come and who try to release those adhesions so that eyeball can move over there. Because if these things are not managed, ultimately they develop scarring over there. The eyelid is moved, the margin moves inside, the eyelashes start rubbing the corneas. So that is very important to be managed. Bandage contact lens can also be applied to prevent these corneal ulcers development over there. But the most important role which I feel is the use of the amniotic membrane. Amniotic membrane is very good in maintaining the contour of the eyeball, prevention of the treatment of the corneal ulcers, and prevention of infection, very important. And it can be repeated many times, and it is very beneficial in the management of the Stevens-Johnson syndrome. But in spite of all these medical and surgical management, the cornea, the corneal epithelium, which is basically responsible for maintaining the transparency so that light can pass up to the retina, there's no more healthy over there. It developed metaplasia. It undergoes certain transformation, that it developed the characteristics feature of the skin like this, I can simply say. So it becomes opaque over there. The eye is under inflammation, scarring is happening, goblet cells which are contributing to the tear film, those are also affected. So all these things contribute. We try to put punctal plugs so that the tears usually which go into the nose don't go over there. And but sometimes the dryness is that much, nothing is going to work in such situations. And people have tried corneal transplants, but transplants don't work. The reason is cornea needs hydration, it needs tears for its health. But when there is no more tears, dryness is severe over there, and again they can develop ulcers, again infections can happen. So corneal transplants is not a solution. As a last resort, the medical community and ophthalmologists and eye surgeons have tried to use keratoprosthesis, or we can say artificial corneas. It can be tried in the late stages with limited success, because it also has its possible complications. So this whatever I was talking to you from the eye point of view, but it is beyond that. It is not vision threatening, it is life threatening condition which can happen. So it needs medical specialists, skin specialists, gynecologists, urologists, all work together to control this disease, so that, because the internal body organs are also involved, so it's a life threatening also. And I have seen a few patients in my career. It is not a 1 or 2 days disease which you manage, and no, the patient develops a long-term association, and you have to manage sometimes these patients for years, one complication and the other, it continues. But by the proper care, timely care, as I mentioned, the complications can be minimized, the treatment can be effective, and this disease can even then be managed very effectively if the interventions, if the treatment is properly done and everything at time is done. I hope my today's discussion about this disease, Stevens-Johnson syndrome, which is not very common, will be beneficial to my respected audience. I want to thank them for their attendance and attention. Thank you.